What is melasma?
Go ahead, Anne-Marie. Take it away.
It is large brown patchy spots. I have melasma, so it presents itself different, but it's usually in the form, it's on both sides of the cheek. It could be the mustache, and sometimes it's across the forehead.
In medical terms, we call it hyperpigmented patches on your face, located in sun exposed areas.
Who gets melasma?
Well, we typically think it's women, but on occasion men can get it too. You most commonly see it in women who have some sort of hormonal change, whether it's birth control, having a baby, that sort of thing. But it's also very prominent in people who work in fields that are hot, such as chefs and that sort of thing. You'll see it on those women's faces as well because of the heat.
Yes. And typically, it's 90% of patients are going to be females, as Anne-Marie said. We notice it more in darker skin types. However, we do see it in lighter skin types, such as Anne-Marie. It is affected by sun exposure, hormones, and also heat. So there was a study that was done that found that women that were making tortillas actually had an increase in melasma.
How do you treat melasma?
There are several routes that we take to treat melasma. It's very difficult. Whoever has melasma needs to understand that there is not a one-shot treatment to get rid of it. I treat my melasma several different ways. One of the primary things I do is I use Obagi, which is a bleach, and I use tretinoin on a daily basis. It helps control the melanocytes, and the hydroquinone in Obagi gets rid of the appearance of the pigmentation.
Exactly. And you never want to forget your sunscreen, correct?
Tons of sunscreen. And in fact, they have so far advanced in sunscreens that this is the first year that I've had the least amount of reoccurrence in my melasma. And I was telling Dr. Jochen just the other day, I think it's because of the new sunscreens that prevent that radiant heat from causing that post-inflammatory pigmentation.
Yes. So the mainstays of treatment are going to be bleach, retin-A, and sunscreen. And also we have all of the devices that were developed to help with melasma. And what we find with all of these devices is that a third of the patients will get better, a third of the patients with melasma will stay the same, and unfortunately a third will get worse. And with melasma, when it gets worse, and you don't really want to take that risk. So if you're going to places where they're telling you to use devices on your melasma, be very, very skeptical. The one thing that is showing some promise is the tattoo laser removal devices, but the one side effect that can happen with that is that you can lose pigmentation.
And here at Contour Dermatology, we absolutely do have the most experience with melasma patients.